I always say if you want to know the trends in public health, watch the porn. Ain't nobody using condoms out here.
We don't see these content creators also talking about what they do to make sure that they're keeping themselves well.
Yes.
Before they shoot. Once I see a condom on, I'm skipping to the next video.
Interesting. Likewise. Hello, and welcome back to another edition of Keep On Loving the podcast. I am Javontae Lee Williams, and this is my beautiful co-host.
I am Ahmea Pacheco Branch.
When you have to check your own names.
Because I always want to be Ahmea Rose, but the people out here don't. That's my other persona.
Aw.
Yeah.
I like that one.
I'm going to go by Ahmea Rose.
That's how I have you saved in my phone.
Well, great, because that's who I really am. Ahmea Pacheco Branch is the corporate girl. That's where the checks are made out to.
The checks are made out to Ahmea Pacheco Branch, hyphenated.
Crawford.
So before we started talking, I had asked you if we could come back to your business idea because we were talking about
and I have
who's the guy that just got locked up? Tory Lanez.
Okay. Ooh, we were talking about a couple people getting locked up, but yes, Tory Lanez. Yes.
Locked up, they won't let me out. Oh. So we were talking about Tory Lanez, and I made the comment about someone who has a content creation subscription service.
Because that's who I thought you were originally talking about first. That's my mind first went to.
And then it brought me back to the idea. So you wanted to do brand development for content creators with subscription services.
Yes, absolutely. Super easy. Yes. Oh, yeah. I would love to do that. That's like super easy. It's super fun. And, you know.
Yeah. So, like, what would that be like if I had a content creation subscription service?
So what you would do is we can do editing. We can do recordings, slicing, graphics on there, all of the other greatness. We can make sure that everything gets up there monthly. So, listen. So with creating content like that, you only need like 10 minutes worth of content. 10 minutes worth of content is at least 2 weeks, because when you're dropping little clips and stuff like that, you only really got to post once or twice a month. You're getting people's money for about $8.99.
You're such an enterprising young woman. You have so many ideas. Like, you also told me about like a recovery house for people in transition. Like, you have so many good ideas.
You got to have, as a trans Black woman, there's not too many jobs you can have paid in the back pocket, especially working in public health. You love public health. Public health just doesn't pay as what you needed. So you got to always make sure that a good friend Javontae told me to always make sure you have a good extra job in the back pocket.
That friend is very wise. That friend is very wise. So today we're going to be talking about, we're going to add to our series that we started a few episodes back called What the PrEP.
Ooh, okay.
What the PrEP. And
was it Emily or it was Emily or?
I miss Emily and Brian.
Come back to us.
Brian, Emily, come back.
Please, we miss you.
Come back.
There's a seat at the table.
Your camera is here.
Oh.
That's my camera.
All right.
Come back to us, Brian.
To us.
Emily.
Yeah.
But we started What the PrEP, and it's basically an evolving series, and I wanted to talk to you today about myths concerning pre-exposure prophylaxis.
PrEP.
So we'll put a description up on the screen of what PrEP is, but, there are multiple forms of PrEP now. So back in 2012, when the FDA first approved the medication to prevent HIV.
Truvada.
It was Truvada, yes.
The blue pill. Is it still blue?
I think it's blue.
I stopped taking mine and had to take a whole new set of medications.
But it was blue, and I think that's one of the criticisms of it, because it was like the other little blue pill. But now you have Descovy. You also have Apretude. You have a bunch of medications, and you have like even more technologies that are coming out. So like, I know they're working on anal douches, vaginal douches. They're working on rings.
Please tell me more about these anal douches.
I don't know. I don't know enough to tell you about them because I think that a lot of them are in development.
Okay.
And they're testing. They're even working on an HIV vaccine to prevent HIV. So, like, there's a variety of technologies. But we're talking about the ones that we have. So I had sent you a list that I found on WebMD, and we'll put the link in the show notes.
Okay.
But I thought it would be really good to go down and debunk these myths and give our opinion on it.
Let me pull my handy-dandy phone out there.
So, myth number 1, PrEP is only for gay men. Well, on the surface, like.
And so that right there itself has a lot of women asking me a lot of questions, especially when I talk about PrEP. And it's hard for them, some of them, to believe that PrEP is really for them also because of how it is displayed or talked about within the community, and especially on like commercials and stuff like that. And when I just literally say it's not tested in women, but for me, that also makes me nervous to say. But that's a whole nother conversation.
I'm really curious, like, why everything goes back to gay men. Like, HIV was only a gay disease. PrEP is only for gay men. You know, like, even when Mpox was starting to be a thing last year, like, it was only for gay men.
You
right?
actually got my, you say a lot of things to make my brain roll, but when you...
Is that like an eye roll?
No, you just make a lot of things like, if you have never worked with, like, side note, if you've never worked with Javontae in a professional manner... Even if there's nothing wrong, Javontae will find something to challenge just to make sure that we have thought about everything.
It's called critical thinking.
So when you started talking about monkeypox last year and just about different things, you started making my mind roll. So like when I think about monkeypox.
Not to be confused with an eye roll.
No. I never roll my eyes at you.
So fact, PrEP is for anyone who doesn't have HIV but is at risk of getting it through sex or IV drug use. The CDC recommends PrEP if you have had anal or vaginal sex in the past 6 months. I wonder how they came up with that number. Probably related to a study. Because I'd say like the last year. Anyway, all right. You and your partner haven't used condoms every time your partner has HIV, or you were diagnosed with a sexually transmitted infection in the past 6 months, or you're a woman with an HIV-positive partner who is trying to get pregnant. That's an interesting fact. We'll have to come back to that. Myth number 2. You don't need to use condoms if you take PrEP. Now, this one.
Right. Let me know.
Let's get into this. Because if you look at Twitter.
I mean, you should. Oh, go ahead.
If you look at Twitter, if you look at some of the other sites, right? If you look at some of the content subscription services, ain't nobody using condoms out here.
And I wish we could talk about that. Is a whole nother thing when you talk about my subscription and like things like that. Like being more like, we don't see these content creators also talking about what they do to make sure that they're keeping themselves well.
Yes.
Before they shoot.
Like testing for STIs on set sometimes.
Well, I mean, because some of them don't have sex. Some of them are at the Ramada right down the street. Okay, let's be honest.
Is Ramada still a thing?
I don't know.
I remember Ramada. You were dating yourself at the Ramada down the street. I don't think we have any Ramadas in Philly.
What was it? Yeah.
So they're down the street at the Ramada.
At the Ramada, like, they don't... But being able to... First of all, again, you talk about making money. If I'm a content creator, right? Boom. Why would I not press on these other pharmaceuticals to do work? I'm literally doing sex work. You literally have things to help me.
First of all, if this were a drinking game, we went that whole period without saying sex ever, I believe.
Oh.
That's a lie, because I just talked about sexually transmitted infection. But we didn't say it in that way. But
yeah, but like, if that's the work that I'm doing, and why would I not want to bring more brand awareness around things? Because a lot of us, well, I know me, I learned a lot of things from
watching and consuming content.
Correct. So there's a lot of things that they don't teach us, but that's a whole nother thing.
I always say, if you want to know the trends in public health, like, watch the porn. Because what's presented popular in porn, people want to emulate. They want to enjoy themselves. And so, like, there's a reason certain genres and niches appeal to some people. It's because that fantasy is based in a reality of certain folk. And, you know, however you fantasize and escape in your content, I think, well, I digress, but ain't nobody using condoms.
Nah.
And I think that, like...
But it's cringy. I'm going to be honest. It's cringy. Like, I'd be like...
Cringy to use condoms?
Yeah, to see... Okay, it's cool for me. I can watch great things. Once I see a condom on, I'm skipping to the next video.
Interesting. Likewise. So, yeah, I think, you know, that, and we have to, like, grapple with the fact of where society is now and then adapt our prevention modalities for that. So, you know, if barrier protection, which condoms are, isn't in practice, what are other ways to stay safe? And, like, I really am a fan of DoxyPep. So DoxyPep is medication that you take after the fact to prevent, like, other infections. So, you know, bacterial vaginosis or chlamydia or gonorrhea. Like, you can take medications after the fact to prevent those from occurring. And if you're not using condoms, I think that's something helpful, like considering PrEP on the front end and DoxyPep on the back end.
But what about the girls in the back that do not?
You just caught it, didn't you? Doxy on the back end.
Yeah, I got you. What about the girls who, like, are against? And when I say girls, I mean I use that loosely. That's everybody for me. That are not a fan of pills.
That's an interesting conversation.
Because we still have DoxyPrep. Like, what if we have someone who a doctor has already gotten them to get...
We'll have to find a scientist to come on, because I don't know too much about that. And I don't want folks to eat me up in the comments.
And I know, like, we have the injectable still, but, like, yeah, like, that was always my question. And then when it comes to using condoms, the... people don't also know about the different ways to be able into, like, I just found out just within doing this work within the last 2 years of doing this work that you should be putting lube in the tips of the condoms and things of that sort so that you can make sure that you have the same pleasure from the outside and the inside, which made sense. So maybe if people also knew different ways to be able to use condoms to be able to have it more pleasurable.
Have you ever tried to do that?
I'm a lady, so I don't know. So I'll have to ask a gentleman.
That is not what I was inferring. But what I mean is it gets a bit convoluted. Like, to do all of the...
It's not.
It gets a bit convoluted.
So
and
okay.
We got to move on.
We do.
Because I need to read this fact.
Yes.
PrEP prevents HIV from... Wait, hold on. Sorry. I'm not wearing my glasses. Let me push them up. PrEP prevents HIV from multiplying in your body. If you're exposed to the virus during sex, using condoms every time you have sex will protect you from being exposed to the virus in the first place. Condoms also protect against other STDs like chlamydia, gonorrhea, which PrEP doesn't prevent.
Right, that's what I was using. That's what I was trying to get to.
Yeah. Myth number 3. It's hard to get a prescription for PrEP.
It's so not.
This is kind of on the borderline for me.
It depends. Actually, go ahead. Because I have people who tell, especially women, I have had to help so many women advocates, cisgender, real women. I've had to, like,
shade.
Because, you know, some people don't.
It's
I got you. Thank you. They don't get... Like, doctors don't get, some doctors refuse to give CPAP women PrEP. And I'm just like, what makes them any different than myself as a trans Black woman or yourself as a gay Black male? Like, what makes...
Who is gay? That man is gay. Yeah, I think, for me, I'm on the bubble with this one because it is a myth. Right? PrEP should be easily accessible, but for certain populations of people, like, depending on where you live, it can be really difficult to get PrEP. Like, that's one of the reasons we created PhillyKeepOnLoving.com. And we put the teleprep program on there because people had a hard time getting appointments. You know, you go to a doctor and the waiting list is 3 months. That should not be. And in many places, it's not like that, right? But why am I looking for PrEP in a haystack?
So what about when someone gets an appointment and the doctor doesn't feel like they are in need of PrEP? How do they advocate for themselves?
I always say, can you make a note in my chart why you're not giving me that medication? Because they're not going to write it down. They're not going to write down that we had a discussion and I refused to do something that the patient requested, right? Unless you're asking for oxy. But they're not going to write down that they refuse to give you pre-exposure prophylaxis. They just won't do it. So that's a tip. What do they call it? Insider tip, expert hack. Write down, ask your clinician to write that in your chart if they say they won't give you something.
Can you ask, because I'm going to expound on that. Can you ask to see that note before you leave?
Yeah.
Okay.
It's your body. Okay. It's your medical record, right?
The people?
Myth number 4. Well, let me give the fact. Any licensed healthcare provider can prescribe PrEP. If you don't have a primary care doctor, you can visit a health clinic or you can search a doctor through the HIV services locator on hiv.gov. Or you can log on to phillykeeponloving.com if you live in Philly.
phillykeeponloving.com.
Myth number 4. You only need to take PrEP after having unprotected sex.
Now, I also... Help me out, because you are my PrEP person. Like, when I think about PrEP and people ask me PrEP questions, I'll be like, hold on, let me go ask Javontae, because Javontae really knows. I have fallen more out of pushing PrEP, where I push PrEP, but some of the knowledge is rusty for me. So I was being told about how people can do it in clusters. Like, if you're not a person who is always sexually active, but when you are, you do it for 3 or 4 months and then go about your day for a year.
Yeah.
Is there a way that you can double up on it or do it just specifically for that time? Is there?
Yeah. So, well, it's not doubling up, but it's called 2-on-1, episodic PrEP, right? Where when you're going to have sex and you know you're going to have sex, then you would take PrEP. You would take 2 pills, then 1 pill, and then 1 pill after sex, right? And you can Google 2-on-1 PrEP. It'll give you the instructions. The challenge with that is, I always give in my talks or when I'm talking about this, people who schedule their sex probably also take advantage of the Denny's happy hour special because young people don't schedule sex. It just happens sometimes, right?
Sometimes, unless you have a sneaky link.
Unless you have a sneaky link and you arrange things. But usually sex is more spontaneous. And so even if you know the day of, it may be too late to initiate that, right? So the best way to take PrEP is actually what the fact says for this. You have to take PrEP consistently for it to protect you from HIV if you're ever exposed. Post-exposure prophylaxis, this is the one that you take after, or PEP, is the pill you take after having unprotected sex or barrierless sex, right? When you take PEP within 72 hours of possible exposure, it's very effective at preventing HIV, but PEP is only for emergencies and it's not a substitute for PrEP. So in Philadelphia, we have the PEP Center, and that's a hotline you can call. And we have our PrEP partners, right? So if you live in Philadelphia, you can get access to PrEP. You can get access to PrEP.
What if you're just traveling through Philadelphia and you may need some PEP? Is it easy to get, or is it like you got to get back home to wherever you're from?
That's a good question, but I think we can help you out.
All right.
I think we can help you out. And you can go to hiv.gov.
Because, we have a couple festivals coming up, so we need to let the girls know where to
go. Myth number 5. PrEP is really expensive.
You know what?
This is on the bubble for me, too.
I mean, now working within the medical field, for me, no medication is expensive. It's all in how well the care team that you have. Because with one good doctor stroke of a pen can change how things are. One good case manager with your insurance provider can change how everything is.
Yeah. Well, the reason I'm on the bubble with this one is because some of the newer technologies.
True.
Like the injectable PrEP. it's a pretty pricey medication.
It is.
But if you get the pills, right, like it's almost free. And the government has several programs to make PrEP no cost to you.
Except if it's pill form.
Yes, yeah. So depending on the type of technology you want, it will depend on the accessibility and the cost.
So does that have to do with, what's the word I'm looking for? In the way people's social economic statuses. So,
yeah. Well, no, because I don't think they do like an income test or anything. Like you don't have to prove anything for your income. Like if you want it, you can get access to
are you
it.
saying someone with maybe a private insurance, like I have a private insurance with our agency. Like, is there a way I would get turned down for injectable where someone who is maybe dealing with
that is an insurance question. I'm not an insurance expert, so I'm going to leave it to the experts because I don't want to put misinformation out here and then somebody be like...
I'll be trying to think for the people.
But here's a fact. PrEP drugs can be expensive. They can cost up to several $1,000s a month. That's on top of the lab cost and doctor's visits, which can be as much as $15,000 a year. But you probably won't have to pay anywhere near that amount. Most private health insurance plans, Medicare and Medicaid, cover the cost of PrEP. Insurance also pays for doctor's visits and lab tests. If you don't have health insurance, you can get programs like Ready, Set, PrEP and the Vive Connect to help you pay for PrEP. And I know Gilead also has a program that can help you pay for PrEP as well. Myth number 6. PrEP is only for people who have multiple sexual partners.
Well, no. I mean, no. True. No. I was saying true to myself that the no was right. Don't you? I talk to myself. I don't know. Like, I had to think. And I was like, no, you was right. No, right.
Fact. Even if you only have sex with one person, it's good to take PrEP. Right? Especially if your partner has HIV with a detectable viral load, or if you're not sure of your partner's HIV status, or if your partner is an IV drug user, or if your partner has sex with other people. Yeah. So I think, a couple years ago, there was this thing like Truvada whore, and people were shaming folks who took PrEP as like just being promiscuous. I think we've moved past that just a bit.
Oh, because what did I just say before we start recording? If you are not pro-ho, you are not pro-nothing. Like, what?
I think the word you're looking for is sex positive.
Sure.
Hashtag pro-ho.
Hashtag pro-ho, sex positive, like all of that greatness. We're in 2023. People are literally busting it open online for $3.99. Like it is here. Our parents have done it. Our great-grandparents have done it. It's been around. It's in the music. I don't understand why people act so. I think it's because we're in.
So I think this is a good place to stop for this episode with busting it open for $3.99. So, thank you, Ahmea, for a very interesting conversation. You always have such an artful way with words.
Well, if you don't understand how much I love this work, I think this episode has really shown.
I think they've gotten it. I think they've gotten it. And I'm going to say to all the $3.99 folks, you need to go up on your prices. It's 2023 inflation. Thank you so much for joining us for another episode of Philly Keep On Loving. My name is Javontae. This is my co-host.
I'm Ahmea.
And we will see you in the next one.
And remember, no matter how you're loving, just keep on loving.
Pow.